Hi everybody, my name's Andrew. I'm a veterinary professor of animal welfare at the University of Winchester Centre for Animal Welfare in the United Kingdom. And I'm going to be talking about educational animal use and alternatives. My story began when I was actually a veterinary student at Western Australia's Murdoch University, where I began the veterinary course all the way back in 1997. And I had the vague idea that harmful animal use might be part of the veterinary curriculum when I enrolled, but I was unaware of what the details would be, and I rationalised to myself that if I was required to harm animals in the course, it would be worth it because I'd be able to help so many more animals afterwards as a qualified veterinarian in practice. And so, thus unprepared, I'm afraid, I entered first year. And in first year, we dissected slugs, snails, rats, body parts from abattoirs. Oddly, there seemed to be a strange obsession with lampreys, so we dissected some of those as well. My strategy of not thinking very much about the issue served me very well until the end of first year, when I was sort of forced to confront the issue and think about it properly by a particular cell biology laboratory class. And in this class, the body parts were not appearing neatly prepared on dissecting trays for us. In this class, the animals were still alive. The living, breathing rats were being killed right there and then for our use, so that we students could dissect out the still living intestinal tracts and measure the uptake of glucose from various solutions by those living cells, to demonstrate some scientific principle that had been well established for decades. And so I was sure that an alternative method must be available to learn this kind of information and that rats didn't need to die to teach this. I voiced my concerns to the instructors in charge of the class and requested an alternative. On this occasion, unfortunately, I hadn't studied the issues. I only voiced my objection on the morning of the lab, and so I was poorly prepared. My request was denied, with the result that I decided to boycott this laboratory class, which ultimately cost me a grade in that particular course, which I'd still passed anyway. But this stirred up a great deal of controversy, with many students and staff supporting my position and many opposed to my position. And ultimately, this lab was dropped from the curriculum the following year, saving the lives, I think, of about 40 rats per year, so it was well worth losing a grade over. At one point, I was called into the offices of the professors in charge, and they interrogated me for about an hour and a half and tried to change my views and gave me dire warnings that what I had seen was only the tip of the iceberg compared to what I would have to do to animals later, and encouraged me to reconsider my career choice. Unfortunately, they were correct. The harmful animal use was very significant in the remainder of the veterinary course. We would dissect greyhounds in anatomy, which were donated from animals that were killed because they were no longer racing fast enough to be profitable to the greyhound racing industry. We would dissect parts of the greyhound, the foreleg, the hind leg, the thoracic cavity, the abdominal cavity, and so on, in student groups on a weekly basis, and the cadavers were stored in a cool room in between. There were some extremely invasive physiology laboratories in which animals were subjected to very invasive procedures and unfortunately killed to demonstrate, once again, concepts that have been well established for many, many years. Other animals were dissected in the anatomy classes, and we learnt surgery by practicing surgical procedures on healthy animals, commonly young pigs, and then unfortunately killing those animals with an overdose of anaesthetic prior to recovery. Now, my professors were not successful in encouraging me to drop the veterinary course, but they did give me a strong motivation to go away and learn really what might the alternative methods be to learn scientific information and clinical skills and surgical skills. Which were the courses around the world that were successfully using those methods, and what was the published educational evidence about their effectiveness. And the humane teaching methods are these sorts of things that you can see here on the slide. High quality videos and simulations of animal experiments or dissections. The use of cadavers obtained from animals that have died naturally or in accidents or been euthanized for genuine medical reasons. Body parts preserved ideally from such cadavers in a variety of different ways. non-invasive self-experimentation to demonstrate basic physiological concepts on oneself or one's classmates, clinical and surgical skills models and simulators, and supervised clinical and surgical experiences. There are many computer simulations that have been developed for dissections. Some of those can have very high quality graphics in them, which is often of much better value, I think, than seeing what a student group can produce with a dissection of a real animal in the classroom. The organs are often very fragile, actually. We found that when we were doing these sorts of dissections, it was very common, unfortunately, to mash up and destroy these fragile organs, making them very visible to see and to see the key features of the anatomy. And once the mistakes had been made, unfortunately, of course, they couldn't be reversed. So often you can get a much clearer picture, I think, using the computer simulations. You're able to look at the histological or microscopic anatomy up against the gross or macroscopic anatomy as well, to see what the microarchitecture of the body part looks like. These simulations can be available via the internet or the intranet at universities. This is a very good example from the Colorado Veterinary School. Students can look at different parts of the greyhound. They can look at bony anatomy, soft tissue anatomy, radiographic anatomy, select different parts. In this case, the head has been selected. Click on different parts of the simulation and it will bring up information about, in this case, the masseter muscle, the origin, insertion of the muscle anatomically onto the bone, the innervation, the nerve supply, and the action of the muscle, so what it does. You can zoom in for a closer look. You can drag sliders across the screen and roll the head to look at it from different angles and directions. You can look at radiographic anatomy and clinically relevant anatomy as well. The face is an example of the same thing with a human head developed for medical students at the University of Ohio, and a student can drag their mouse slider button across a slider on the screen and melt the tissues away, starting from the most superficial layers of the skin and going all the way down to the bone. And then by dragging the button back in the opposite direction, all the tissues magically reappear. It's amazing. Students can click on particular structures such as the muscle there and actually cause the muscle to contract, thereby seeing what the effect of that muscle would be on the actual face. And in this case you can see that the red muscle by the nose has been highlighted, and if a student clicks on that, then it will cause the nose to twitch. So certainly not functionality that you would expect to see in an actual dissection. If you did see that, you should be very alarmed. This is the digital frog version 2, and this simulation allows students to look at the dissection of the frog. So students can select from a virtual toolkit, drag those across the appropriate parts of the simulation, and if they do it correctly, then, and they're guided by the simulation to do it correctly, and if they achieve that, then a video clip will play of the actual dissection occurring at that stage of the dissection. You can see an animated functional diagram of the blood circulating through the main chambers of the heart, and you can even click on the speaker button on the bottom right and actually hear what this frog sounds like in the real world and learn something about its natural history as well. So you can potentially learn a lot more than you can, I think, with just a simple dissection of a frog cadaver in an anatomy dissecting room. That's me on the left as a student in our veterinary anatomy museum, and every vet school just about has one of these. Ours was filled, as they normally are, with permanently preserved body parts from animals. You can see me there with the horse's head in sections. These body parts can be preserved in pots containing formaldehyde or other powerful chemical preservative designed to prevent bacterial putrefaction and dissolution, along with colorants designed to preserve colors. There can also be coloured casts made of airways and blood vessels, and you can see a bovine kidney in the upper right picture there, in which the airways and blood vessels are perfused with coloured dyes, and then the soft tissues are eaten away by mild acid solutions over typically several months. and organs and body parts can be plastinated, such as the squid in the bottom right of the slide. And in this, several chemical steps and the use of a vacuum are employed to take out the water and the fats, the lipids, replacing them with sort of polymers, giving the tissue a plasticky feel and eliminating most of the odour. So these sorts of methods can be used to permanently preserve body parts or entire animals, ideally that have been ethically sourced and not killed just for teaching purposes. This is an example of the cast of blood vessels of a liver and gallbladder from a dog at Tufts University, one of the world's leading veterinary schools in the US, and their entire teaching needs for anatomy, clinical skills, and surgical training with respect to cadavers are supplied by their ethically sourced cadaver program, and have been for many, many years, and they have a very large veterinary school. They don't kill any animals for teaching purposes. The airways of the tracheobronchial system in the lungs here of the dog are also supplied from the Tufts Anatomy Museum. And this is Gunther von Hagen, the anatomist who developed the plastination technique, demonstrating that even the largest of animals can be successfully plastinated. And indeed, he has several travelling exhibitions, anatomy exhibitions that travel the world, showing animals and even people, showing the bodies and the body parts that have been successfully plastinated, along with functional information describing what those body parts do, and they're fascinating to visit and learn from, and I encourage anyone that hasn't yet had the chance to look out for one of these and do so if you can. I was particularly excited at London's Natural History Museum when I went to see one of these exhibitions, to see the plaque outside the front entrance of the exhibition that clearly stated that no animals were killed for the purposes of this exhibition. All of them had been ethically sourced. So well done, Dr. von Hagen. This is Dr. Briony Dixon. So she was the first veterinary student to graduate from the University of Queensland Veterinary School without harming animals in her veterinary training. She was also already a PhD parasitologist at the time that she enrolled as a veterinary student. And instead of using healthy animals to practice clinical and surgical skills, which were then euthanized at the end of the procedures, or I should say humanely killed, it wasn't genuine euthanasia, because it wasn't in the best interest of those animals, and that is the definition of euthanasia. Instead of doing that, she used ethically sourced cadavers obtained from animals that had been euthanized for genuine medical reasons and donated for teaching purposes. And she's shown here practicing inserting a chest drain into the chest of a dog, which is an important clinical procedure for removing fluids such as blood or air that might collapse the lungs in the chest space following, for example, a road traffic accident. Computer simulations of animal experiments were originally criticised for being overly simplistic, and when you see this slide from an early simulation, you can understand why that was. Modern simulations, however, employ virtual benchtops with advanced equipment that students have to manipulate virtually. For example, laying the sciatic muscle of a toad across a set of electrodes, applying current to them and observing the action potential travel down the nerves on the oscilloscope visible in the bottom right there. If students get procedures right, they may see simulations of the actual experimental result occurring. There may be high quality video clips of animals undergoing actual procedures and what the effects of certain interventions such as test drugs might be. And you can certainly question the ethics of whether these animals should have been subjected to those procedures in the first place. The fact is that they were. The footage has been recorded, and hereafter it can be used in these simulations without harming any animals further in the process. And it's certainly a better alternative than harming animals each year to obtain these experiences for students. There are many models that have been developed for high school students, and also for laboratory technicians, such as models to help them learn to draw blood from the tail veins of rats. And for veterinary students and nurses, teaching them how to give, for example, cardiopulmonary resuscitation to this mannequin in the top here. This is critical care Jerry, a dog mannequin that has an artificial pulse that can be applied by a trainer. Students can practice feeling for that, listening to normal and abnormal breath sounds and heart sounds, and trying to diagnose problems accordingly. Students can practice drawing fake blood solution and even intubating them, passing tubes down into the airways of these animals, and so on. Here Dr. Dixon is practicing the CPR procedure on one of these critical care Jerry mannequins instead of an anaesthetised dog. Here she is again, this time in London. She has gotten around. And she is practicing bovine pregnancy diagnosis by using a haptic simulator. So this is essentially something like a sewing thimble attached to the end of a robotic arm, and the student puts their fingertips into the thimble, and the computer simulation applies anatomically appropriate pressure to the fingertips depending on where in the simulation they are. The simulation can be set to normal and pathological stages of pregnancy, and the student may have to diagnose different stages and conditions. The professor who developed this teaching alternative has also developed an equine colic model and also a feline abdominal palpation model that similarly use haptic technology, applying pressure to the fingertips of the user that's appropriate to the position inside the simulation of the fingertips. Here's an example of an alternative veterinary surgical training program. These should ideally comprise 3 stages: the use of knot tying boards, plastic organs and similar models to teach basic manual skills such as those you can see there, the use of ethically sourced cadavers to simulate surgical procedures on, and then particularly importantly, the use of real patients students may observe, assist with and then perform beneficial surgery under close supervision, for example neutering animals in shelters. The Daisy is the dog abdominal surrogate for instructional exercises, and it's essentially just a foam cylinder with multiple layers and some coloured threads running through to simulate blood vessels, and some foam intestines in the middle, and yet it's remarkably useful for practicing gloving, gowning, draping, scrubbing, preparation of the surgical field, incising through multiple tissue layers using blood dissection, encountering and clamping and ligating blood vessels, locating intestines, exteriorizing them, bringing them out of the body, keeping them wetted down with saline solution, removing a portion of intestine, suturing the remaining ends back together, and closing all of the layers up. And of course it makes a lot more sense to be practicing all these skills on a model, which by the way is very cheap and can be rotated around and used multiple different times, up to 6 times on a single tube, before progressing to using an animal for these purposes. There are many more advanced surgical simulators that have been developed as well for veterinary medical students. The POP trainer, being the pulsating organ perfusion trainer, which you can see in the bottom left, is essentially a glorified plastic tub in which major organs, for example sourced from ethically sourced cadavers, can be placed, connected to a closed circuit fluid circulatory system with an oscillating pump, and this will allow people to practice minimally invasive surgery or conventional surgical approaches. And if you cut one of the major blood vessels in these organs connected to this fluidic circulatory system, then it will actually bleed, and it might even spurt fake blood solution. So it provides motivation and a good opportunity to practice clamping and ligating and stopping bleeding blood vessels, as would be necessary in real surgery as well. There are also more advanced haptic surgical simulators available for teaching human surgeons as well, and you can find videos of those on the internet. When I was a surgical student, we developed an alternative surgical program that involved gaining external experience in private clinics and animal shelters, assisting with and participating in surgery and anaesthesia. We also had to sterilise real patients from animal shelters at our university too. We also conducted some abdominal surgeries on a daisy and some ethically sourced cadaver surgery on animals being euthanised for medical reasons. So the outcome of this program that we designed was that we missed out as surgeon or assistant on 13 scheduled surgeries using pigs and sheep, but we performed or assisted with at least 62 additional surgeries, mostly in private practice under one-to-one direct supervision, which was a high level of supervision that our classmates received in the normal program. Jointly, we sterilised 45 dogs and cats, including 21 spays, the female sterilisation operation, which is one of the most important ones that new graduates need to be able to do. We participated in a wide range of other surgeries as well, and we also got to see pre-op and post-op care of these cases, so we got a lot more realistic experience, I think. After I finished, eventually I went here to Ross University School of Veterinary Medicine in the West Indies, one of the world's largest veterinary schools. Very beautiful place. This is the view from one of the on-campus eateries looking over the Caribbean Sea. Most of the time, however, students spent their time here in the clinical skills laboratory or the library and didn't necessarily even have time to develop a suntan. So we would teach our students clinical and surgical skills, starting off in first semester using a variety of mannequins, models and simulators, and building on those in a stepwise fashion each semester. So by the time they actually started their surgical rotations in much larger US mainland veterinary schools, with larger caseloads, I should say, in the final year of their degree, they had a reputation for being particularly well prepared because of all of the use of models, mannequins and simulators that they received here. So we were proud of our program at Ross. I was the director of the clinical skills lab when I was there, and with another colleague we published a paper recently, if anyone's interested, describing the considerations that go into designing and establishing a clinical skills lab like this. Since then I've gone to Europe, and colleagues and I have recently looked at all of the summaries of scientific and educational animal use published on the websites of the national authorities in EU member states. And we have published the amount of educational animal use that's occurring annually, and you can see it varies with the greatest numbers at the bottom, and the totals vary from about 124,000 up to 172,000 per year across Europe in recent years. The species most commonly used are rodents, and the procedures most commonly using them are physiology and clinical and surgical skills training classes. The reason these animals are used instead of alternatives is because educators most commonly feel that practice on a living animal is necessary for proper learning and that no adequate model or alternative is currently available. So, to see how valid those concerns were, we conducted a systematic review of the educational literature and scientific literature recently, looking for studies comparing student learning outcomes when they learnt via harmful animal use versus humane alternatives. And we found 50 studies all the way back to 1968. And you can see that some of them had superior learning outcomes for the humane method, the blue ones. Most were equivalent and some were inferior. The disciplines covered were all disciplines in higher education which animals are used, particularly anatomy, physiology and surgical skills training. The humane methods studied were diverse, most commonly computer simulations and models. And overall, the humane teaching methods produced superior outcomes in 30% of the time, equivalent 60% of the time, and inferior 10% of the time. In 2007, I published the largest previous review of this area, also finding 29 studies of vet students which didn't involve direct comparisons with harmful animal use. And I have a table that looks like that. Don't try and read it in the publication. It's available if you want it. But they demonstrated that humane teaching methods often offer other advantages as well, such as these: time and cost savings, increased repeatability and flexibility of use, saving of many animal lives, increased compliance with legislation and code of practice requirements about using alternatives, decreased risk of student exposure to toxic chemicals used to preserve anatomy specimens, decreased potential for conflict with students unwilling to harm animals in their education. So in conclusion, well-designed humane methods usually perform at least as well as methods that rely upon harmful animal use. That's obvious from the systematic review. In some cases, there are superior learning outcomes. Obviously, educators can best serve their students and animals and minimise financial and time burdens by introducing well-designed humane teaching methodologies. Anyone wanting to know more about this can find information and advice for students in universities, alternatives libraries, and more at these websites here. And my website is humanelearning.info, where you can find some of these studies that I've mentioned today. Thank you very much.